Okay, so we've got sister, mom, dad, and little brother as audience. And sister's gonna film. Okay. Okay. Stop making me. One of the top 10 leading causes of death in the United States is Alzheimer's disease. Many younger people often wonder why they should even worry about this, how it relates to them. According to studies done by the Alzheimer's Foundation of America, 1 to 4 family members of every family ends up becoming a caregiver for someone who does have Alzheimer's. So even if you personally aren't diagnosed with it, it is very likely that you'll end up caring for someone who is. By raising awareness on this subject, people can gain the knowledge necessary when confronting this disease. Let's go on to my first contention. What is Alzheimer's? Alzheimer's disease is a progressive degenerative disorder that attacks brain cells or neurons, and ultimately resulting in the loss of memory, thinking and language skills, and behavioral changes. This causes the brain to be clogged by 2 things, which is beta amyloid plaques and neurofibrillary tangles. Beta amyloid plaques are basically clumps of protein fragments that form around the neurons, and neurofibrillary tangles are twisted fibers, insoluble, that basically attach themselves inside the nerve cells. This is why Alzheimer's ultimately is the most common cause of dementia. And my second contention, symptoms of Alzheimer's disease. There are 2 different types of symptoms of Alzheimer's disease. There are cognitive symptoms and there are psychiatric symptoms. The cognitive symptoms, or intellectual symptoms, often include amnesia, aphasia, apraxia, and agnosia. The psychiatric symptoms often include personality changes, depression, hallucinations, and delusions. It is extremely important to recognize these symptoms and these signs as early as possible. Early diagnosis can prevent the rapid progression of this disease in a patient. On to my third and my final contention, treatment of Alzheimer's disease. There's currently no cure for this disease, unfortunately. So most of the time, doctors prescribe medications to treat the symptoms of the disease. And some of these medications include Aricept, Exelon, Namenda, and Razodine. Because this disease not only affects the patients, but the caregivers as well, many researchers strongly advise the use of support services and counseling on a regular basis. Awareness is the only defense that we have against this disease. So, if you take anything away from this speech today, I hope that it is knowledge. Today we have discussed what Alzheimer's is, its symptoms, and its treatments. It is estimated that 5.1 million Americans have this disease right now. So don't assume that you will never have to worry about it or you will never be affected by it. Be aware for your family as well as for yourself. Thank you. Done.